Hello everyone. To my friends and colleagues in Mexico, and in particular to the Mexican Association for Quality and Health and Patient Safety, in the so-called, and in short, in Spanish, AMEXCASEP. I hope I pronounce it okay, AMEXCASEP. And to the members and healthcare workers attending the event where hand hygiene is promoted as the most significant strategy to improve patient safety and quality of patient care. I met some of you in November 2019 during an academic session. I enjoyed to work with you, and during a hospital tour that I made at the time. But unfortunately, I'm not able and I'm not capable, like any of us, to actually come to Mexico for your event this year. But I want, above all, to congratulate all of you, and in particular, Doctora Hilda Marquez Villarreal, who currently chairs the Association of AMEXCASEP. And I know what it means to chair an association, in particular in a time so difficult as the COVID time, as we are all facing today and for the last year. AMEXCASEP is an association of health workers who are interested in learning and exchanging experiences related to improving the quality of health and patient safety, with a very special interest in joining allies in the fight against healthcare associated infections. At the moment, we have, as far as I know, around 60 active members from different areas of the country of Mexico. And these numbers are increasing very, very quickly, and in particular at times of events, such as the event today. I heard that the figure can reach as many as 1,500 people, extending to several Latin American countries. And again, I want to congratulate AMEXCASEP and the chairperson for organizing those fantastic events. Our challenges is to generate a solid space for the further construction of knowledge and guidance in the field of healthcare associated infection prevention and patient safety, and to consider in particular that the national policy of quality and patient safety is currently relatively weak in your country, in Mexico, because of, as we know, government be not very interested in this. So at a time where the government is not that good at promoting and sustaining activities, there is nothing like an association like you created. So already now, I would like to say long life to AMEXCASEP. And today's event is really a good sign of the activity of your association. And I would like first to thank the speaker. So the program of today's Mexican Association for Quality in Health and Patient Safety is quite exciting, and good speakers I know are with you today. I'm talking about Dr. Cristian Arturo Zaragoza, if I pronounce it well, Doctora Marcela Hernandez, Enfermera Rocio Ortega, whom I met, who is the coordinator of the hand hygiene campaign in Narino, Colombia, and of course, Doctora Hilda Marquez Villarreal, the AMEXCASEP president, and we know all her quality in promoting people to work together in a nice way, a nice team, using collective intelligence and energy. So I wish you a fantastic meeting. I wish you a fantastic virtual meeting, because of course you cannot do it differently. And I wish I could be with you today, but unfortunately I can't. We are all fighting COVID-19 for the past year. So we are all very invested into COVID-19 prevention. We know that infections can spread in hospitals and in any healthcare facilities. Now, what were the challenges of the year? Speaking of hand hygiene promotion and speaking of infection prevention strategies promotion. First of all, I would say, for the second time in history, alcohol-based hand rub that was key for most 25 past years as a key for system change in hand hygiene promotion in healthcare institution has now spread to the community. In other words, all the concepts that we develop for promoting and improving hand hygiene in the community, in particular using alcohol-based hand rub, are now used in the community. So isn't it a great reward for all of us who promoted hand hygiene for so many years? So I would like to congratulate you for what you did so far, and please continue to do it. You are not doing it only for your hospitals today, but also for your community. Second, what has been a challenge this year was to make sure that everyone will get personal protective equipment appropriate for patient care practices in right quantity, right material, knowing to use it, and will be provided to each places when necessary, as necessary. I know it has been a challenge all over the world, and I hope you didn't suffer too much in Mexico on this aspect. But I wish you will continue as an association to promote the fact to get the right material at the right time, used appropriately to fight against COVID the same way we are fighting against other bacteria. Third element, after alcohol-based hand rub and personal protective equipment being available, the respect of the guidelines. Social distancing, wearing of a mask when necessary, adequation of isolation and quarantine, be respectful of it. This has been a tremendous challenge. It has also been a challenge to protect our healthcare workers. As you know, in New York, there have been a lot of deaths due to COVID in hospitals. And I know there are deaths in India currently, and there have been deaths in Mexico certainly, and in the rest of Latin America. So please, in infection control patient safety, dedicate your time and energy to help healthcare workers to protect themselves. Now, the other challenge has been the behavior of people. Not only behavior in the hospitals, but behavior in the community. And in particular, in the way people get tested. Testing for COVID is so important for everyone to understand as soon as possible when he would eventually turn positive. Whether a healthcare worker, a community person, we all need to be extremely fast in going to be tested so that we protect our patients or we protect our relatives and the community. And this calls for an important aspect, which is solidarity. Solidarity among people, solidarity between people, solidarity between healthcare workers and non-healthcare workers, solidarity in the city, solidarity everywhere, solidarity between countries. Today in your meeting, I see people from, of course, from Mexico, but also from Costa Rica and from Colombia. Isn't it wonderful to have people around you from those countries, from Latin America, where patient safety is so strongly promoted, in particular through and thanks to the association such as your association. Last but not least, as a challenge for the future and as a solidarity movement, we need all to understand how much vaccination and vaccine promotion campaign are important. Infection prevention save lives more than ever. So get vaccinated, promote vaccines, do it well, do it fast, do it appropriately, the same way we recommend you to do it on this 5th of May. So infection prevention and control used to save lives in the healthcare settings, and now extrapolating to the community is saving lives in the community. Let's now speak about your country and about the 5th of May coming in your country to celebrate hand hygiene. Mexico is among the model country for the promotion of hand hygiene and patient safety. Remember, hand hygiene is the entrance door of patient safety, and you are doing it so well in Mexico, where you are extremely strong in patient safety, and the patient safety movement endorsed hand hygiene promotion. So congratulations again. In 2021, this year, for the 5th of May, we invite all countries around the world and all of you to take action towards the hand hygiene initiatives launched by WHO and UNICEF called Hand Hygiene for All. Hand Hygiene for All is an initiative that UNICEF has started last year and asked us to join on the 5th of May, WHO, to promote the campaign. So this is wonderful. So they are joining and participating to the WHO Global Hand Hygiene Campaign, Save Lives, Clean Your Hands. The slogan of this year is, in English, seconds, save lives, clean your hands. Well, good look at the poster. Our main focus this year is to achieve effective hand hygiene at the point of care, whether it's patient care in healthcare setting or taking care of somebody or joining somebody or actions in the community. Showcase your support and participate to phases of the campaign and send your support and videos with performing hand hygiene. So what we are asking you is to show your support by performing a video where you simply actually perform hand hygiene at the point of care. I'm looking at my hand rub, rubbing your hands with alcohol-based hand rub. As you know, is so easy during healthcare practice. So what we are asking you to do is actually to rub your hands, and then once your hands are rubbed and once your hands are dry, to actually imagine that they are clean, close the video, send it to us. Send it and apply the video to the site of cleanhandsavelives.org, or post it on social media using the hashtag hand hygiene, hashtag clean your hands, hashtag infection prevention. WHO will feature shots of this web wall with the faces of the campaign on social media. Now, look at the campaign logo and slogan. Remember, seconds save lives. Clean your hands. This is in English. I will try in Spanish. Do my best, okay? Segundos que salvan vidas, limpie sus manos. Manos limpias salvan vidas. Now look at the poster that we have created for this year. Here it is. Segundos que salvan vidas, limpies sus manos. Once again, manos limpias salvan vidas. I wish you a great event and great success to your association. Thanking all of you, and hope we could celebrate all this fantastic hand hygiene promotion day. Manos limpias salvan vidas. Thank you very much.